Hello everyone, I'm Anukiranjit Kaur, Assistant Professor in Khalsa College of Nursing, Amritsar. Today I'm here to present our topic Measles. Measles is also known as the rubella. It is also called as the red spot or the red measles. Measles is a highly contagious airborne disease which has the serious complication and death, and it is mostly occur in the children those who are under the 5 year of age. It is endemic in all part of the world, and it may be an epidemic when the susceptible proportion is reaches up to the 40% in the children. There is also a vaccination which prevent the 60 million deaths in the children as per the data 2000. And there is the safe and cost vaccination is available. Due to that, the death rate is decreased. Globally, according to the WHO, globally, the death rate is decreased, that is up to the 1,75,000 globally, and it has a high morbidity and mortality rate in the developing country. In India, it is also a significant morbidity rate in the childhood. There are some challenges for the measles elimination. First major challenge is the weak immunization system of the developing country. Second one is the virus is a very highly infectious virus. Next one is the increasing refusal of immunization by the some population, and next is the due to the inaccessible of immunization due to the some conflicts. Now, what is measles? Measles is a highly contagious disease which is caused by the RNA virus, and it mostly occur in the children those who are under the 5 year of age, and its causative agent is the paramyxovirus. The incubation period of measles is 10 to 12 days from the exposure of the virus till the appearance of the sign and symptom. And now next is the how the measles is spread, or we can say the transmission mode of transmission of the measles. Measles virus live in the nose and throat. So the person who is healthy, if they are contact in the secretions of these nose and the throat secretion, they can get the infection. And the virus is also land on the surface, and that is active for the 2 hours on the surface. If the person is touch the contaminated surface, they can acquire the infection. And this virus is present in the infected person from the beginning of the incubation period still to the rashes are appear. Now, how the people those who are at the risk of measles, there is some people they are the risk at the measles. First one is the children who are under the age of 5 years. Second one, those who are having the low immunity system. Next is those who are not get vaccinated, they are more prone to the infection. And the person, mostly in the children, vitamin A deficiency is there. Those who are having the vitamin A deficiency in the children, they easily get the measles. Now next are the clinical features of measles. Basically, clinical features of measles are categorized into the 3 categories according to the nature of the measles. First one is the prodromal stage, second one is the eruptive stage, and third one is the post-measles stage. In the prodromal stage, it is characterized by, firstly, it is started after the incubation. When there is the incubation period, it is started on the 10th day of the incubation. Then still last it on the 14 days. And it is characterized by the fever, coryza with sneezing and the nasal discharge. Photophobia is there, redness of the eye, and the lacrimation. These are the symptoms of this disease. And this disease present up to the 5 days. And after that, then the person is the basic symptom in this stage is that is the Kolpic spots. The Kolpic spots are the tiny spots which are bluish in color, and the white spots which are present in the lining of the mouth. This is the major symptom which are present in the first prodromal stage. Now second, there is also a present of a fever in this stage. And now next stage, that is the eruptive stage. Eruptive name itself then when the rashes are appear. This stage is started after the prodromal stage, and in this stage the fever is disappear, and diarrhea is disappear. In the first stage there is a diarrhea is also present, and in this stage is up to the 4 to the 5 days when the rashes are appear. In the first stage there is a Koplik spot. In the second stage, that Koplik spot it is converted into the rashes, and the now in the prodromal stage and the 3 to 5 days of the eruptive stage, person is infected with the virus and they can carry the virus to the other healthy person. Next, third stage is the post-measles stage. In the post-measles stage, the symptoms are disappear, but still the susceptibility of the person to get the infection because there is the weak immune system in the patient. So they can easily get the bacterial infection or the viral infection. Now, next is how we diagnose the measles if the person is getting the measles. Firstly, basically, we can conduct the clinical assessment. In the clinical assessment, we distinguish the spots or the, we can say the rashes which are appear on the body. Is it measles rashes or the other diseases rashes? If there is a measles rashes, it means there is the Koplik spots are present which are having the small bluish white spot are present in the lining of the mouth. In this way, we can diagnose the measles. Next one is the blood test, or we can say a lab investigation. In the lab investigation, we can conduct the lab blood test to just identify the, to just confirmation for the measles virus, if it is actually a measles virus or the other disease virus. Next are the complications which mostly occur in the measles patients. First one is which is very common, that is called the otitis media, or you can say the inflammation of the middle ear, and that spots are also spread from the middle ear and rapidly it cover the face, and after that within the few hours it cover the face, and after that it covers the whole body, and it take 2 to 3 days to cover the whole body. Next complication is the pneumonia, diarrhea, and encephalitis in the pregnant mother. There is a miscarriage, or we can say the abortion or premature delivery. And next one is the low platelet count, that is the thrombocytopenia. Now, after the diagnosis, how we treat the patient, those who are getting measles. There is no any specific treatment for the measles patient, but there is a symptomatic management for the measles patient. In the second stage, there is a diarrhea is present. So to control the diarrhea, instruct the patient or instruct the mothers to give the plenty of water to their children to prevent the dehydration. If there is a fever, then give the antipyretic medicines to the person, and if there is any bacterial or viral infection, in case of the bacterial infection, give the antibiotics to the patient. Like a pneumonia or otitis media is also a complications of the measles. In that cases, we provide the antibiotic to the patient. Next one is the, in case of the fever, we give the antipyretic medicine to the patient, or if there is any infection, bacterial infection, then give the antibiotic to the patient, like pneumonia and in case of the otitis media. There is also a preventable vaccination or a post-infection vaccine is also there, which is given within the 72 hours after the exposure to the virus, and also give the antibodies to the patient within the 6 days after the exposure to the virus. These can prevent the symptoms of the measles. Basically, it is present in the children and there is a deficiency of the vitamin A in the children. Then firstly, we should concentrate on the vitamin A deficiency just to prevent the symptoms of the measles or prevent the measles. And in the vitamin A deficiency children, how to give the vitamin A supplement to the children? If the children age is less than 6 years, then give the 50,000 international unit of vitamin A to the children on the day of the diagnosis and in the next day of the diagnosis. Then we provide the 50,000 international unit of the vitamin A to the children. If the children age is 6 to 12 month or 6 to 11 month, then give the 1 lakh international unit of the vitamin A supplement. If the age is more than 12 month, then give the 2 lakh international unit of this supplement, vitamin A supplement. Their vaccination is also available in the immunization schedule, and the measles vaccination is available in the form of the freezing dried product, and we store it at the 2 to 8 degree Celsius temperature, and the dose is given to the children, that is the 0.5 ml, and the route is subcutaneous on the right upper arm. And the time duration when we give the measles vaccination to the children, basically in the immunization schedule, we give the measles vaccination at the month of 9. And if the mother can skip to conduct the vaccination at the month of 9, they can administer the vaccination at the month of 12. So the total duration of the measles vaccination is up to the 12 month of the age of the children. Next is last is the how to prevent the measles in the children. There are the basic. Measles is a contagious disease and the viral disease. The prevention is better than the cure. Then the person, those who are in the prone area, or how to prevent the measles, there is the only one way, that is the vaccination. The vaccination, triple viral vaccination is available in our immunization schedule. In that we give the MMR vaccination, that is the measles, mumps and rubella, just to prevent the measles in the children. And if the person is infected with the measles, then only one step is there, that is the isolation. Isolate that person from the healthy persons until that person is not recovered. In this way we can prevent the measles vaccination. Last, or we can say the not least, hand hygiene. In the as you know, the mode of transmission of measles is the nasal secretions and the throat secretions. If we touch that secretions with our hands, and after that we use our hands by touching the mouth, nose, or rubbing the eyes, that virus also transmitted to the healthy person. So hand hygiene is the basically is the most important part to prevent the measles in the children. That's all about the measles. Thank you.